So, first question, how do you ensure continuity of care for individuals with ADHD across different life stages?
So one of the things that I like to do to ensure quality of care across the continuum of age is to make sure that I have family engagement, that we are checking in at all stages of the game. So initially, when I have a young child who may be in kindergarten or first grade, I definitely require a lot of input from the teachers and from the parents to provide feedback as far as how well they're doing. And then as they get older, and I'm certainly looking at other metrics to make sure that they are still receiving quality of care. And often, one other thing that sometimes people forget about is that the family may not have the resources to continue to purchase the medications or to have access to care. So one thing that we always assess is the functionality of the family and what economic resources they have to bring to bear.
And then our second question, so what tips would you give to clinicians that will help them provide culturally competent care for diverse populations?
So one of my first tips is the framework that you deliver your questions to families, really recognizing the fact that in diverse populations, they may view ADHD very differently. Some populations may actually embrace that diagnosis where others are terrified and afraid of it. And so I think it's really important to normalize the conversation that ADHD is very prevalent and actually ask a lot of open-ended questions so that you get a good sense of where the family is coming from their perspective about ADHD. And I think when you have that open dialogue, you also gain trust and respect from families. And I think it helps eliminate some of the messaging across, online that suggests that doctors are only in the business of prescribing medication and that is it. When in fact, we're in the business of helping parents and helping children and teens and young adults with ADHD thrive.
How can clinicians ensure that ADHD care meets both clinical and individualized needs for long-term patient success?
I think the best way to meet the clinical need of the patient is to ensure that they are on the most effective medication dose that they can be on, and that requires close monitoring and dose titration. I think, though, that it's not just about the medication management. It's also about how has their quality of life improved and how have those impairing symptoms gotten better. So questions about getting along with your peers, getting along with your parents, your siblings, your grades in school. Can you participate in an after-school activity? That's the best way, I think, to determine whether or not they're going to have long-term outcomes that are really, truly beneficial.
Fantastic. Thank you. And second question, how can families be empowered to advocate for their child's needs within the educational system?
So I think that's very hard for families, especially families whose parents might also have ADHD, and then parents who are, working full time, managing, their own life stressors. And so the way I suggest people do that is by giving them resources in the community. Each community should have potentially a family advocate or a peer navigator, someone who can maybe walk them through the system. I also try and help them by writing letters to the school and then providing them with a list of resources that the school might be able to provide.